Hey guys, hey, it's Dr. Jere Mills here with Mills Chiropractic and Wellness Center. And we're starting a series on immune resilience and strengthening our immune system and navigating a immune response. And so, this first topic I want to talk about is inflammation or a pro inflammatory state. You know, the immune system, we really have kind of two parts to it. We have the antioxidant or anti-inflammatory aspect, and we have a pro-inflammatory aspect of the immune system. And so when we have an infection or, maybe even an injury or something like that, we really want a good pro-inflammatory immune response. We want to rev up the immune system, right? And then as we get control of the situation, we want to shift to more of an anti-inflammatory immune response or uh, flipping that switch over. And as Americans, that's a lot of times where we have trouble, and really as the world, is that a lot of times we're pretty decent at being in getting a pro-inflammatory state, but we have a harder time shifting back over. And the reason for that is most people are actually living in a pro-inflammatory state all the time. So before they even get an infection or they have an injury or something like that, they're already in this pro-inflammatory state. They throw another thing that would trigger even more inflammation, and they're up here all of a sudden, and they just can't mount that secondary response. And so, whereas we work through this, we're going to talk about some things to improve that secondary response as well. But one of the first things I want to talk about is this pro-inflammatory state. Now, the easy way to tell if you're in a pro-inflammatory state, by the way, is basically with two things. Ask yourself, do you hurt? Do you have aches and pains in the body that just kind of continue day after day, and maybe they move around in different places, but you have this continual irritation to the body? And are you fatigued? Those are two dead giveaways that you're probably in a pro-inflammatory state, right? And so the question is what causes that pro-inflammatory state? Now, there's lots of things that can do that, but one of the big things that a lot of times that we're seeing is that it's food triggers. It's excessive sugar or dysglycemia, not regulating blood sugar real well. It's toxins, it's environments, and so one of the first steps to starting to regain immune resilience is to help to identify what those triggers may be that may be putting you into a pro-inflammatory state, um, making you less resilient towards an injury or an infection, right? And so one of the questions that I want you to start self-assessing, one of the first ones is, are there certain foods that when I eat, I feel more soreness, achiness, discomfort, or increased fatigue? Are there certain environments, like, maybe in damp environments, for instance, moldy environments, you feel more achy, soreness, fatigue? Now, I don't want you focusing, completely on your symptoms and catastrophizing and things. That's not helpful either, and we'll talk about that in another webinar. But I want you to start paying attention. And one of the troubles with like food sensitivities that we see a lot is that you don't necessarily eat something and immediately feel sore, right? It's usually a day or two later. And the other problem is so many people are living in such a pro-inflammatory state that they're there all the time. So they can't tell sometimes what tends to be the triggers for them. They can't tell what pushed them further down the road because they're already so far down the road anyway. And so that's sometimes where doing a detox diet, not necessarily a cleanse, just lowering down some of the common pro-inflammatory foods like gluten, dairy, eggs. For some people, those are can be very pro-inflammatory for them if they're sensitive to them. And so, one of the things you may want to consider if you know you're living in this pro-inflammatory state, but you're not sure what your triggers are, is to really focus on eating a clean, vegetable-based, high-quality protein diet for a period of a couple of weeks, and then reintroduce some of those foods and start seeing, do I feel worse a day or two, after I've been eating this stuff? If so, probably a good probability that one of the or more of the foods that you have re-added, you're sensitive to, and it's promoting that inflammatory state. So again, we're going to be going through a lot of in-depth information. I think inflammation, pro-inflammation status is one of the biggest culprits with immune suppression and immune weakness. And so that's why we're starting here. So again, Tune in next time for our next webinar. I'm going to try to keep them short as I can, but we're going to cover a lot of information as we go. So I hope there was something in this webinar that you got, something that you learned, something that you can apply. And so I hope you'll tune in next time for our next episode or installment of this series as we continue to dive deeper and deeper into the immune system and inflammation and just that whole pathway. Which, by the way, before I move on, um, the word inflammation is actually an immune response. Okay, so whenever you hear those two words, you should think of as interchangeable in a lot of ways. It's just how do we modulate that immune response and inflammation, and that's what we're really going to be addressing through these webinars. So again, I hope you got something from it. Tune in next time.